Good morning. Am I audible?
Yes, sir.
Good morning. Good morning. Am I audible?
Yes, sir.
Good morning. Six. Now, our today's topic of discussion is Schedule Aim of the Drugs and Cosmetics Rules 1945. Now, Schedule Aim, probably you know that Schedule Aim provides the GMP and the requirements of premises, plant and equipment for pharmaceutical products. Now, our today's topic of discussion is Schedule Aim of the Drugs and Cosmetics Rules 1945. Now, Schedule Aim, probably you know that Schedule Aim provides the GMP and the requirements of premises, plant and equipment for pharmaceutical products. Now, our today's topic of discussion is Schedule Aim of the Drugs and Schedule Aim provides the GMP requirements Now, the Schedule M is broadly divided into two parts, Part 1 and Part 2. Part 1 provides good manufacturing practices for the premises and materials, whereas Part 2 for requirement of equipments in the factory premises for different category of is products. Divided into two parts, Part 1 and Part 2. Part 1 provides good manufacturing practices for the premises. In the Part 1, today we will discuss Part 1. Whereas Part 2 that is the GMP for premises and materials. Now, what are the general requirements? General requirements, first you have to see what should be the location and surroundings of a drug manufacturing unit. The factory buildings where pharmaceutical products are being manufactured shall be so situated. Now, what are the general requirements? General requirements, first you have to see what should be the location. So the factory building shall be so situated and shall have such measures as to avoid risk of contamination from external environment, including to avoid the risk of contamination from external environment, including open sewage. There should not be any open sewage nearby the factory, open drain, public lavatory, or any factory which produces obnoxious odor, fumes, excessive soot, dust, smoke, or any chemical and biological emissions. If there in the surroundings such types of factories are remaining, then that place will not be a suitable place for a pharmaceutical manufacturing unit. So it is the first criteria for selecting the site of a pharmaceutical unit. What kind of location is good location to maintain the GMP? What will be the good surroundings for a pharmaceutical unit? That you have to select first, whether the site is suitable, whether the site is provide or allow us to maintain the GMP. Second, in the site, you have to construct the building. How we will construct the building such that it will help us to maintain the GMP norms, good manufacturing practices. The building used for factory shall be designed, constructed, adapted, and maintained to suit the manufacturing operations so as to permit production of drugs under hygienic conditions. They shall conform the conditions as provided under the Factories Act 1948. So buildings should be such that the walls and floors of the areas where manufacturing of drugs is carried out shall be free from cracks. There should not be any open joints, because you know that if there is any open joints, it will allow the accumulation of dust and debris, and that may contaminate your product. The chance of contamination will be more, chance of cross contamination will be more, because the powders, the pharmaceutical products may also accumulate there. So the building should be such that the walls and floors, ceilings shall be smooth, washable, and all the joinings, like joining of the wall and ceiling, joining of the wall and floor, that should be coved. Coving means the shape will be concave shape in the joining area, which will minimize the chance of accumulation of dust. So it should be coved such that it shall not permit any accumulation or minimize the chances of accumulation, as well as it will permit easy and effective cleaning and disinfection. The interior surfaces shall not shade any particles. That is also another very important as far as construction of the building is concerned. Moreover, the building materials which you have to use to construct the building, it should be compatible with other drug manufacturing operations inside the premises. The premises should have air handling units. Air conditions were prescribed for the operations and dosage forms under production. The production and dispensing areas shall be well lighted, effectively ventilated with air control facilities, and may have proper air handling units. Humidity, temperature should be maintained. Proper drainage system should be there in the building. What does we mean by the proper drainage system? That means that the drainage shall be of adequate size, and it shall be designed so as to it can prevent backflow. Also, it can prevent the insects and rodents entering into the premises. Open channels shall be avoided in the manufacturing areas, and where provided, the drains shall be shallow, not will be deep, such that you can easily clean and disinfect those channels, those drains. These are the requirements of the buildings and premises. Now, water system. There shall be validated system for treatment of water drawn from either own building, own land of the said factory, or any other source. It may be municipal supply water source. And it should render it potable. The water should be potable water in accordance with the standards specified by the BIS, Bureau of Indian Standard, so as to produce purified water which will conform to the standard of the pharmacopoeial specification, that is the IP specification in our country. The disposal of waste, the disposal of sewage and effluents shall be in conformity with the requirements of Environment Pollution Control Board. of that particular state pollution control board. And all the manufacturing units, they have to follow, they have to comply the provisions of the biomedical waste management rules 2016 with its latest amendment. So you have to keep in your mind that in all the manufacturing units, they have to comply the provisions as far as regarding the disposal of wastes. They have to maintain the provisions of the biomedical waste management rules 2016 made under the Environment Pollution Act 1986. Now the warehousing area, these are the part of the GMP which manufacturing unit, pharmaceutical manufacturing unit has to be maintained. This is a very, very important part of your pharmaceutical jurisprudence curriculum, because in industry, if you work in an industry or if you work as a regulatory affairs officer, regulatory affairs personnel, you have to know the requirements, legal requirements, what are provided under the Drugs and Cosmetics Act and rules, which each and every manufacturing unit has to be maintained. For it is a condition of license. To maintain the condition of license, they have to maintain the GMP norms. And the GMP norms, what are the provisions you have to comply? That has been provided under Schedule M. So Schedule M is the GMP for the modern drugs. Now it has different parts. Under the general requirement, we are seeing that what kind of water system should be there, what kind of buildings shall be provided, what kind of location and surroundings should be there for selecting for erecting a pharmaceutical manufacturing unit, how or what provisions you have to maintain as far as disposal of wastes and effluents are concerned. Then warehousing area. Warehousing area, you know that warehousing area means the area where storage of different kinds of things are being done. Storage of raw materials, storage of packing materials or packaging materials, storage of finished goods, storage of machinery parts, storage of equipments. So you have to provide a large area which is needed to store all these type of things. These areas should be properly ventilated, lighted, and it should have the manufacturing sites, that means walls, floors, ceilings should be such, which I've already told you that accumulation of dust can be prevented. And moreover, proper pest control and cleaning should be done, and regular records of that kind, that cleaning should be maintained for inspection and audit. Next is in the warehousing area, it should be segregated in such a way that you can keep the products in proper manner to avoid any mix-up or chance of contamination. Like whenever you are receiving anything, that item, that raw material, or if you have your warehouse have received any finished goods, it will be kept in the quarantine area. That area is quarantined. It should be properly labeled that it is quarantined item because it has not been tested. The quality has not been assessed till now. Then whenever the samples will be taken from that quarantined product, it may be quarantined raw material. So raw material you have received, packaging material you have received, you keep it in a place in the warehouse with a label that it is quarantined. Then your people of the quality control will draw sample from that stock of raw material or packaging material or finished goods of the warehouse. And there will be, in adjacent to the warehouse, there will be sampling booth for taking sample. Then the sample will go for testing. After, whenever the samples will be taken from that stock of quarantine stock, it will be labeled in different manner. Then it will be labeled with under test level, with different colored level under test, which will tell you that this stock of product, either raw material or packaging material or finished goods, has been sampled, and it is now, its status is now under test. After testing, either it will be approved or it will be rejected if it has not passed the standard quality, standard specifications. Accordingly, it will be displaced from that place of under test to the segregated particular space for approved product, approved raw material, approved packaging material, or approved finished goods. Or it will go to the rejected place. And with proper labeling for rejected product, there will be a label of rejected. If it is approved, approved, and different color code labels are used. So this is about the maintenance of the warehousing area. Next is production area. So production area shall be designated to allow the production, preferably in uniflow and with logical sequence of operation. That is very important. Production will be done in uniflow sequence. It should not be any zigzag sequence or random sequence. That means one operation after another, it will move in a uniflow direction, in a logical sequential direction, which will minimize the chances of cross-contamination, chances of particulate contamination. So this is a very, very important requirement of our GMP as well as WHO GMP or World Health Organization GMP provisions. So always the production area, the placing of equipments, the operations should be such that the uniflow direction of operations is maintained. The pipework, electrical fittings, ventilation openings, and similar service lines shall be such designed, fixed, and constructed such that it can avoid accumulation of dust. So in the production area, all the facilities, the pipeline of water pipeline, electrical lines, and other lines, service lines, that should be made in such a way, it will not come out from the wall. You will see that in the olden days, all these pipelines were visible in the room, and which provides the large amount of accumulation of dusts. So that is not allowed now. You will not get the license. Your license will not be permitted to manufacture in the premises, in the production area where this type of pipelines or fittings or ventilation is given or provided. So that is also important. You have to see the production area, whether they are maintaining these things or not, which will enhance the chances of accumulation of dust and pollution. Fourth item of this GMP part 1 is ancillary area. There will be some ancillary area provided. Ancillary areas means in a factory, not only the production, warehousing areas are there. There is the area where the workers can take rest. Workers can go for their refreshment, canteen like this. So this restroom, refreshment rooms will be there, toilets will be there. Moreover, maintenance workshop will be there. And these places are termed as ancillary area of the manufacturing unit. These areas will be separate from the production area and warehousing area. It will be separated. Their entrance will be separate. It will not be connected internally with the production area or main manufacturing area. So you have to see that these areas, these ancillary areas should not have the direct access from the manufacturing area. Moreover, the animal houses, it will also be separated in the ancillary area. Next is the quality control area. It is another important area in the manufacturing unit. Quality control laboratory shall be independent of the production areas, and it shall be divided into sections like physicochemical or chemical laboratory, microbiological laboratory, biological laboratory, radioisotope testing facilities were provided, instrumentation room. These are the separate segregated areas where by the quality control, total quality control laboratory is divided into. The quality control area of a pharmaceutical manufacturing unit should have a separate air handling unit. I will discuss air handling unit in some detail when we'll go to the uh, injectable sections. So air handling unit, which is commonly termed as AHU, you have to know these terms, these abbreviations also, such that you can say in the factory or wherever you will go, you will face in an interview that what is AHU? It is the air handling unit. So air handling units shall be provided as per requirement of that area. As per requirement of the area, the separate different type of AHU you have to provide. So QC should have a separate AHU, not mixed with the production area. And now the sixth topic is personnel under the general category, general requirement of GMP. So personnel is also important as far as GMP is concerned. And it is specified in the Schedule M that what kind of personnel should be provided in the manufacturing as well as quality control as well as quality assurance section. So in the manufacturing as well as in the quality control, the persons who are responsible for direct supervision, they are termed as competent technical staff, or in abbreviated form CTS. So who can be a CTS for a manufacturing operation in a pharmaceutical unit? Their qualification has been provided under the rules, and it has been provided that for the manufacturing facilities for non-biological type of drugs, that means the drugs which are not included in Schedule C and C1, that is the drugs which are not biological and special products, what kind of qualification and training is mandatory to become a competent technical staff who can get the approval of the licensing authority to act as a CTS of that manufacturing unit? That is, he must be a graduate in pharmacy or pharmaceutical chemistry with minimum 18 months, that means 1.5 years, 18 months practical experience in the manufacturing of drugs. However, there is a provision that if that graduate, pharmacy or pharmaceutical chemistry graduate, he had taken training during his course of B.Pharm or graduate in pharmaceutical chemistry curriculum, maximum up to 6 months during his second year, third year, fourth year curriculum. If he has taken the training in an industry in the manufacturing of drugs, then that time, that duration will be deducted from the total 18 months mandatory minimum training period to become an approved competent technical staff. So if a student, if he has taken a training in the manufacturing unit, say for 4 months during his course curriculum, then in place of 18 months minimum training, he only has to take 14 months minimum training to get the approval to become a competent technical staff for manufacturing. In case of quality control and quality assurance, same way, he has to be a graduate in pharmacy or pharmaceutical chemistry with training, sufficient training in the testing and quality assurance. Other than this pharmacy qualifications, if he is a chemical engineer or MBBS degree holder, he must have a training, minimum training period of 3 years. If he is a BSc or MSc, He also should have a 3 years training in manufacturing of drugs. And these are the qualifications required to become CTS or competent technical staff. Now, the health, clothing, and sanitation of workers. Another important criteria to be maintained, and not only to be maintained, each and every manufacturing unit has to keep sufficient records to show that the manufacturing unit is complying with that particular provisions, like the provision of personnel, quality control, etc. You can see whether it has been provided in this fashion or not. Similarly, health, clothing, and sanitation of workers. What does it say as per the provision of the schedule M? The personnel handling the drugs, whenever he has been given the employment, at the time of employment, all the personnels who will be coming in direct contact with the drug in the manufacturing facilities or units, he or she shall undergo medical examination, including eye examination, and shall be free from tuberculosis, skin and other communicable diseases, and also contagious diseases. So that kind of examination, medical examination, should be conducted on the staff who will be inducted, and records should be kept. And not only that, after this appointment or entrusting the job, at regular intervals, the medical examination in this regard has to be done by the medical officers of the factory or by any medical officers assigned the job of this medical examination of the staffs, and that record should be maintained. And if the personnel handling the beta-lactam antibiotics like penicillin, then the penicillin sensitivity test should also be done on that employee, whether he has any sensitivity or not on that particular drug. Clothing, all the personnel should wear covering, body covering, appropriate to their duties. Before entry into the manufacturing area, you know that change rooms will be provided, separate change room for each sex, with adequate facilities for personal cleanliness like wash basin with running water, clean towels, hand dryers, soaps, disinfectants, and even footwears. Yeah, it has to change from the outer footwears and outer dresses. And the dresses which will be provided, that should not shed any particle. That should be checked. That kind of clothing will be taken. Otherwise, that clothing which will be worn by the staffs, it will contaminate the production area. Smoking, eating, drinking, chewing, or keeping plants, food, drink, and any personal medicines shall not be permitted inside the production and inside the quality control laboratory area, inside the storage of drugs area. So within the manufacturing facility areas, this type of smoking, eating, drinking will not be allowed. And for this purpose, the employee maintaining all the norms, after removing his factory clothes, he has to come out, or she has to come out from that area and go to the restroom or refreshment room for that purpose. So these are the requirement for the health, clothing, and sanitation of workers. Now, sanitation in the manufacturing premises. And manufacturing operations and controls. All manufacturing operations shall be carried out under the supervision of the technical staff approved by the licensing authority. Precautions against mix-up and cross-contamination has to be taken, and that should be recorded also. To prevent mix-ups during production stages, material under process shall be conspicuously labeled, each and every product, to demonstrate their status. All equipment used for production shall be labeled with their current status. So equipment has to be properly labeled. There should not be any equipment in the manufacturing area which are being used without any label. That is also against the GMP norms. Even the packaging lines, it shall be independent and adequately segregated. It shall be ensured that all leftovers of the previous packaging operation, including labels, cartoons, caps, that should be cleared before closing hour. It is the duty of the competent technical staff to supervise and done. Before packaging operations are began, steps shall be taken to ensure that the working area, packaging lines, printing machines, and other equipment are clean, free from any products, materials, and spillages. The line clearance shall be performed according to the appropriate checklist, and that should be recorded. There should be checklist in the each factory that you have to give the packaging line clearance certificate, and then you have to check it, give it the clearance certificate according to the checklist, and you have to record it. That record is also a part of the GMP, and that documentation is required during the audit. The manufacturing environment shall be maintained, and you have to keep the record that what is the manufacturing environment, how you are maintaining, what is the condition, what was the condition at the time, and that record like temperature, humidity, cleanliness, it will be recorded, and the documents shall be maintained. Authorized persons shall ensure changeover into specific uniforms before undertaking and manufacturing operations, including packaging. And this shall be segregated, secured areas for, there shall be a separate area, segregated area for recalled or rejected material. If any material has been recalled or rejected, you have to keep it in a segregated area, and for that purpose, an area, separate area will be provided. So manufacturing premises, sanitation of the manufacturing premises shall be cleaned, maintained in orderly manner. The manufacturing area shall not be used for storage of materials, and a routine sanitation program shall be drawn up. SOP will be there, and you have to follow accordingly, and you have to keep the record of sanitation. Raw materials. We have just, in the previous class, we have discussed about Schedule U, where it has been mentioned that whenever a manufacturing unit purchased raw materials, how he will maintain the records, that is provided in Schedule U. So the licensee shall keep an inventory of all raw materials to be used at any stage and maintain records as per Schedule U. All incoming materials shall be quarantined, which I have already told you, immediately after receipt. All materials shall be stored under appropriate conditions. You have to see what is the condition for preservation of this raw material, and accordingly you have to preserve it or store it. Then you have to take the sample. Then you have to properly level. That is, it is under test. After testing, if it is approved, then approved. Raw materials in the storage area shall be appropriately labeled. Labels shall be clearly marked with the following information. That is designated name of the product. And if the manufacturing unit has an internal code reference for that product, so that code reference will be given as per the SOP. Analytical reference number will be provided there, which will give you the history. That analytical report number or reference number will be printed or labeled. Manufacturer's name, address, and batch number, the status, whether it is quarantine or under test or released, approved, rejected, like this. Then the manufacturing date, expiry date, that also will be mentioned. And you have to issue the raw material first come, first serve, or according to expiry date. You have to see that whenever you are issuing a raw material, whether it is within their life period or not. And not only that, you have also to see that the life period of the particular raw material which is used in a particular finished product, the expiry date of the finished product cannot be more than the expiry date of the raw material. Say one raw material, its expiry date is December 2021. And the manufactured product, that is, say, paracetamol tablet, you have manufactured, its expiry date cannot be after this December 2021. So That you have to see. It cannot be used in that product. If you have, whenever you are taking the samples for testing from the raw material containers, that containers shall be identified, and only raw materials which have been released by the quality control department and which are within their shelf life, that can be issued. Raw materials shall be kept in the storeroom in on the raised platforms or racks, not directly onto the floors. Next is equipment. Equipment shall be located, designated, constructed, adapted, and maintained to suit the operation to be carried out, to be done. And defective equipment shall be removed immediately from the production or quality control area. If there is any not working condition equipment is there, it shall be removed. Now the documentation and records. How this documentation and records shall be maintained, that we have already discussing. Documentation is a very, very essential part of the quality assurance system. And as such, it shall be related to all aspects of the GMP, good manufacturing practices. Its aim is to define the specifications for all materials, methods of manufacturing, control, and to ensure that all personnel concerned with manufacture know the information necessary to decide whether or not to release a batch of a drug for sale, and to provide an audit trail that shall permit investigation of the history of the product. So documentation, all SOPs should be there, and you have to see that whether the SOP, the requirement of the SOP has been maintained or not. Next, labels and other printed materials. Labels are absolutely necessary for identification of the drugs. And the label, you have to see, the quality control chemist will see that whether labels are at par with the provision of the law as well as the provision of the manufacturing unit or not. If it is approved, then it will be kept in the approved place. Labels, stock should be recorded. How much label has been taken, that should be maintained. And you have to take appropriate measures to avoid the chance of mix-ups of printed packaging materials. And prior to release, all labels for containers, cartoons, and boxes, all circulars, inserts, leaflets, that should be examined by the quality control personnel. Now the quality assurance. Next para is quality assurance. It is also an important wing of the GMP in a manufacturing unit. And this is a wide-ranging concept concerning all matters that individually or collectively influence the equality of a product. The system of quality assurance, you know, it is appropriate to the manufacture of pharmaceutical products. It shall ensure that the pharmaceutical products are designed and developed in a way that takes account of the requirements of GMP as well as GLP, or wherever is needed, GCP, good clinical practices. GLP means good laboratory practices provided under Schedule L1 of the drug rules. Quality assurance team will arrange adequate arrangements are made for manufacture, supply, and use of the correct starting and packaging materials. They will see that adequate controls on the starting materials are provided or not, or the intermediate products, even bulk products, are maintained or not. That finished product is correctly processed, checked in accordance with the established procedures or not. And the pharmaceutical products are not released for sale or not supplied before authorized persons have certified that each production batch has been produced and controlled in accordance with the requirement of the label claim. Very, very important. And after that only, it will be allowed to release for sale. Self-inspection, next paragraph, self-inspection and quality audit. It has to be done by each and every pharmaceutical manufacturing house as per the requirement of the Schedule M. And whenever there should be written instruction for self-inspection. Now, where will be there? It shall include personnel who will do it, premises including personnel facilities, whether it is provided or not, maintenance of buildings and equipment, storage of starting materials and finished products, how it is provided. And that area will be self-inspected and audited by the personnel assigned the job. The equipments you will see, the production and in-process controls, how it is maintained, quality control department, documentation, that will be also self-inspected and audited, how it is maintained, sanitation and hygiene, validation and revalidation programs, calibration of instruments, recall procedures, how it has been made, whether it has been properly kept or not, and how it has been uh, practiced, level controls and result of previous self-inspection also to be provided or kept as record. This is the requirement for self-inspection and quality audit by the manufacturing house itself. Quality control system, which I have already told you, that quality control shall be concerned with sampling, specification, testing, documentation, release procedure. Release will not be done by the quality assurance personnel, it will be done by the quality control in charge. And specifications will be given properly. Next paragraph is master formula records. Now, master formula records, that is the MFR, it will contain the name of the product, name, quantity, reference number of the starting material, which I have already told you in the previous class when I have taught the Schedule U. And packaging records shall be maintained. Packaging record is another very important paragraph in the GMP, another requirement where name of the product will be given, description of the dosage form, tablet or injectable, strength, composition, pack sizes, complete list of all packaging materials, reproduction of relevant printed. There will be record of packaging, and that is a very important, which will give you how many products has been produced in the packaging. Then batch packaging records and batch processing records, or BPR, that is like your BMR, batch manufacturing records, BPR or batch packaging records. What are the informations will be there in the batch processing records that we already find in Schedule U, and that same thing is provided here, that informations to be maintained like name of the product, batch lot size or batch number, date and time of commencement, signature, amount of weight taken, what is the theoretical and actual weight taken, like this. I have already told you under Schedule U, so I'll repeat it again. Next is SOPs, or standard operating procedures. Very, very important document, SOP, and SOP for each and every operation. The SOP should be there in the company, like for sampling, receipt of materials, sampling, batch numbering, what is the methodology of batch numbering, assigning of the batch numbering, testing protocols, records of analysis, validation, calibration of each and every instruments, validation of process, stability testing, how the stability testing will be done, maintenance, cleaning, sanitation, training, pest control. So for every operation, there will be, for complaints, how the complaints will be taken, what is the methodology of complaints, and after getting the complaint, what will be done, what is the methodology of recalls. Every operations, there will be some standard operating procedure that will be made by the responsible personnel of the company, that will be printed and kept in the proper place, and the personnel who are responsible, they will see that this methodology are being followed or not. So SOP, making of the SOP, and maintenance or observation of this SOP is very important to maintain GMP. Now the reference samples, you should have the knowledge. This, what is reference sample, how it is kept in the manufacturing unit. Each lot of every API, active pharmaceutical ingredient. API means active pharmaceutical ingredient in a quantity sufficient to carry out all the tests. Whenever you have received raw material, you are using the raw material after its approval, then you have to keep sufficient quantity of that active raw material, which are active pharmaceutical for the dosage forms, in sufficient quantity such that you can retest it at any time if there is any complaint or any problem in the market. And it should be maintained, retained, or it should be kept in the factory for a period of 3 months after the period of expiry of the last batch produced from it. So last batch, last formulation which has been made using that raw material, you have to keep the raw material for any further testing up to a period of 3 months after the expiry of the last batch produced from that particular raw material. And also you have to keep the finished products, reference sample of each and every batch you have to keep up to the 3 months after the expiry date of that product for rechecking, for getting the status of the product after its marketing. Reprocessing and recoveries is another important. Proper SOP will be there and it will be maintained. It is necessary for GMP maintenance. Distribution record in detail should be there. After release of a particular batch, where it has been given, supplied, entire distribution records will be properly maintained such that for any problem, it can immediately be seen that where it has been distributed, how it can be recalled from the market. So it is another important criteria for GMP maintenance. Validation. Validation studies, another important study. Different types of validations are there. And validation studies shall be an essential part of the GMP, and this shall include validation of processing, validation of testing, even validation of cleaning procedure. If it is once validated, it will continue. You don't have to repeat it or retest it. But if any time you change the procedure or any time any problem arises, then you have to validate the processing, say processing of manufacturing or testing method or cleaning procedure. One procedure is used for cleaning, say factory premises. If any problem arises, then you have to validate it again, that whether there is any lacuna in this procedure or not. Product recalls. For the product recalls from the market, if any problem arises, you have to recall it immediately, and it should have a proper SOP and product recall methodology that should be provided, recorded, and the document should be maintained. There should be proper methodology for complaint receiving and adverse reaction reporting. And another, the last one is a very important thing, is site master file. Site master file, SMF, is another important document. It should be made and kept by each and every manufacturing unit of the pharmaceutical products. The licensee shall prepare this document. It has the following informations, like the general informations, like brief information of the unit, the form, what kind of form it is proprietorship, partnership, or private limited company, like this. And pharmaceutical manufacturing activities as permitted by the licensing authority, what kind of products it is allowed to manufacture, if it has done any other kind of manufacturing activities or not. Then personnel, what kind of personnel it has, that record, that briefing will be there. Premises, simple plan will be there, and the details of the premises it has for the manufacturing facilities, it will keep the record in the site master file. Site master file will also allow it to know the equipments provided there, the sanitation programs, how it is followed, the written instructions, documentation, how it is maintained, production, brief description of production operations, quality control facilities, how it is provided, distribution, complaints and product recall system, what kind of system it has, what methodology it is following, that will be written there in the site master file. What self-inspection and auditing methodology will be followed, that will be recorded. And if it is exporting any drugs, that procedure also will be written in the site master file. So site master file is a very, very important document, and that document is also a requirement of GMP. In the first part, moreover, after this general requirement, some specific requirement for specific type of pharmaceutical products are being mentioned. So out of these 5-6 type of products, I have just taken 3 products I will discuss today. One is the injectable products, I mean sterile products. It may be injectable, large volume or small volume, or sterile ophthalmic preparations. It's a very, very critical and sensitive product, the sterile products, and a very high degree of precautions, preventions and preparations for manufacturing it to be taken is needed. You have to first see the general requirements. I have already told you. The dampness, dirt, darkness should not be there within the aseptic room where manufacturing will be done. There shall be strict compliance in the prescribed standards in the matter of supply of air. What kind of air is, you know that air is supplied through these air handling units. There is heating, chilling towers for the temperature maintenance and taking the outside air through a blower. Air handling unit supply the air either vertically or through the horizontal way. And air handling unit, when it supply the air in the manufacturing room, it supply the air through filter. That is a HEPA filter, HEPA, high efficiency particulate air filter. So it removes the bacteria and other microbes, pathogenic organisms and dirt particles to make the manufacturing room free from such areas. This type of air is provided in all kinds of pharmaceutical product manufacturing, but separate type of filter is used for separate graded air is required according to the product produced. Whenever it is sterile products, there's a high class of clean room is required. Clean room class will come later. You see, there will be strict compliance of the prescribed standards in the matter of supply of air, supply of water, and obviously the active materials and the maintenance of hygienic environment. The manufacturing areas shall be clearly segregated into support areas. That means where washing and component preparations, etc. are done. The preparation area where the bulk manufacturing preparation is done and non-aseptic blending or mixing is done, etc. Then change rooms. Change rooms means the rooms in the entry place it is provided for changing the outside dresses and take the factory dresses. Now, for the aseptic areas, whenever you are entering in the aseptic area, the change room is totally different kind of change room than your oral liquid preparation or tablet capsule preparations like this. It is always 3 rooms will be there. One is black room, one is gray room, and another is white room. First, you will enter in the black room. Black room means it is the air quality which is maintained there, that is not so much high class of room. It is maybe C grade room. According to the gradation of clean room is as per our country is concerned, 3 graded clean room are there: grade A, grade B, and grade C. And also grade D is there, grade A, B, C, D, 4 kinds of rooms. Grade A means high class of cleaning room. It is aseptic preparation and filling is done in that room. Grade B is the surrounding rooms of the aseptic room. Background rooms of grade A are maintained. Grade B quality of clean rooms. Grade C, it is for the preparation of solution, just next grade. If we go to the class, then it is the grade A means 100. Grade B means 10,000 and grade C means 1 lakh, depending on the particulate matter provided in the present in the air. And here the black room where the hand of wash basin will be provided. Then you will enter into the gray room, and then the white room. White room's air condition is more or less like the aseptic room air condition. So these 3 kinds of change room, you have to cross one after another and change your outside dress and take the totally sterilized dress finally. And after wearing the sterilized dress, headgear, footwear, you will then enter into the aseptic room for your duty. The rooms where 20 air changes per hour, the air has to be changes time to time. Otherwise, the oxygen level as well as the dirt particulate matter contamination will be more. And generally 20 air changes per hour is done with good airflow pattern. Grade A area, you have to provide laminar airflow workbenches. Laminar airflow workbenches, that means through HEPA filter, air is coming, air is blowing into laminar airflow workstations, and work is done under this airflow system. and the airflow rate shall be 0.3 meter per second plus minus 20%. Vertical flow, for vertical flow, and if it is horizontal flow, then it will be 0.45 meter per second. Differential pressure, you know that between areas of different environments, say from B grade to C grade, C grade to D grade, or B grade to A grade, whenever you are changing the gradation of clean room, the differential pressure, always there will be pressure difference. And pressure difference is 15 Pascal. Why pressure difference is maintained? To keep away the dirt particles from the lower grade room. So which one will be higher pressure area? The more cleaner room will be higher pressure area, because it will not allow the air to come into that area from the lower grade clean room. So if it is A grade room, the aseptic room, where the final preparations of injectables are done or sterile products are done, its pressure will be maximum. Then the next 15 Pascal lower pressure will be in the B grade surrounding rooms. So if you, whenever you will entering from B to A, you may enter, but that air of the B will not enter because it is higher pressure area. The doors will be opening on which side? Door will be opening in the higher pressure side. So in the ISO class, that is also classified in this way. And all environmental parameters shall be verified as follows: particulate monitoring in air, 6 monthly interval we have to measure it. HEPA filter integrity, we have to see that the HEPA filter which is provided, how far it is working. Its integrity testing done every year. Air change rates, you have to see 6 monthly, that whether the air change rate is maintained, which has been given here or not. But the temperature and humidity is measured daily, and you have to see. And at the same time, microbiological monitoring by settle plate you have to provide with proper agar media or culture media. And after certain time, you will take the plate, see in the microbiological laboratory that whether how many bacterial contamination is there. It will give you that what is the air condition or manufacturing area environment, how much pathogenic organisms are there. So this microbiological monitoring is done to see the microbiological contamination. It is done daily. Now the water quality. Potable water means it is allowed 500 colony forming unit, CFU, bacterial colony forming unit, 500 per ml of the water. And it's also, moreover, it should be absent from any individual pathogenic microorganisms, Escherichia coli, Salmonella, Staphylococcus aureus, and Pseudomonas aeruginosa. Per 100 ml sample, you will see, and it should be nil. And that kind of potable water is used for making purified water. Purified water is done, you know, that is by DM plant, demineralization shall be done to prepare the purified water. That should maintain, that should follow, comply with the specification of Indian Pharmacopoeia, and it should not have more than 100 CFU. From this 500 to 100 CFU per ml, and it also should be absent from pathogenic microorganisms in 100 ml. And if you have to prepare water for injection, that is prepared from this purified water by distillation. So WFI, or water for injection, its quality, it should not contain more than 10 colony forming unit bacteria per ml. How you will store this WFI in the manufactory? You have to keep it in the circulation. That will be through stainless steel pipe, or in the tank that will also be made by stainless steel of 316 grade stainless steel, which is provided, which is maintained in the GMP provision, not below that quality of stainless steel. And moreover, these WFI will be always maintained at 70 degrees centigrade, such that no organism can grow their bacteria. Another thing you have to, probably you have seen the large volume parenterals, like commonly you are saying saline, I mean infusion fluids. And this type of injectables are nowadays not formed in a glass container. It is formed in plastic container, and the plastic container is made inside the pharmaceutical manufacturing unit itself, such that no contamination is coming from outside. It is made in two ways: either form fill seal, we say it is FFS, or blow fill seal, or BFS technology. So plastic granules are used inside the factory to prepare it, and other injectables which are kept in the glass containers, only the glass containers of two types, USP type 1 and USP type 2 are used for this sterile parenteral products. USP type 3 is there. USP type 1 means borosilicate glass and USP type 2 is treated soda lime glasses. It is treated such that no thing is coming out from the glass to contaminate your pharmaceutical injectables. USP type 3 may be used in case of non-parenteral type of preparations. And the room temperature is maintained in the aseptic area, that is 27 plus minus 2 degree, RH 55% plus minus 5. SOP shall be available. Bioburden of bulk solution should be measured, and the layout and design of the manufacturing area shall be strived to minimize the risk of contamination. Drainage shall be adequate, and in the factory, if you go through the oral liquids, I think today's time is over. Okay, it will be taken the next day. So up to the injectables, I'm able to complete today. And there will be some other formulations. Two formulations I will talk you. One there is the oral liquid and another is tablet and capsule. Then we'll go to the part 2 of the CEDULAM or GMP. Students, any question? Anybody? কারো কোনো কোশ্চেন আছে তোমাদের? Some terminologies which are using here, you have to keep in your mind. GMP means good manufacturing practices. Do you know the meaning or full form of ICH? ICH? কেউ বলতে পারো? International Council for Harmonization. International Council for Harmonization of Technical Matters, Technical Requirements for Pharmaceutical Products. কোনো কোশ্চেন না থাকলে আমি আজকে কমপ্লিট করছি।